What's your situation?
Please help me. My wife is having a baby. I need an ambulance now.
Sorry, sir, we don't have any ambulance in your area. You need to get yourself to the nearest hospital on your own. We are very sorry, sir.
Okay, I take her on my bike.
Good evening and welcome to Maternal Health Channel television series. My name is Anita Erskine, your host. Children are our most valuable asset. In Ghana, however, about 80 newborn babies die every day before reaching the very first month of their lives. The first 24 hours to the end of the first week is particularly critical. That period accounts for 75% of newborn deaths throughout the country. Medical opinion is unanimous that these deaths are preventable. So why are they dying? What are the essential healthcare interventions needed to ensure that these newborn babies not only survive and grow, but thrive into healthy children? Tonight, our studio discussion seeks to find the answer to this precise question. Before then, the birth of a baby girl in Accra.
La General Hospital, Madam Vivian is in charge of the delivery ward today. Like most days, it is a busy time with mothers at various stages of delivery. Soon it is Giftiedu's turn, and she delivers Amma, a bouncing baby girl. There is relief, but for the medical staff, the anxiety will linger for a while, because in Ghana every day, about 80 newborn babies die before reaching the first month of their lives. These deaths can be devastating for families, but they are preventable. So what are the essential healthcare interventions that are needed to ensure that the newborn survives, thrives, and grows into a healthy child? Baby Amma is put on the chest of her mother, and within 30 minutes, she is breastfeeding.
The breast milk that comes in the first few days of life, the colostrum, is rich in antibodies. And antibodies are proteins that help us fight infections. So generally, children who are breastfed tend to have a stronger immunity to fight against common bacterial diseases, common illnesses that will cause coughs, colds, diarrhea, infections of the ears.
Baby Amma also receives her first vital vaccinations.
Once a baby is born, as much as possible within the first 24 hours or the first day of life, the baby must have one vaccine we call the BCG. It vaccinates against tuberculosis. The second vaccine that we give in the immediate newborn the same day is the oral polio vaccine 0. There is a third vaccine, which is the hepatitis B vaccine. Currently, we are giving to babies whose mothers are carriers of the hepatitis B virus. As also part of our essential newborn care, within the first 60 minutes, you should have given the baby vitamin K intramuscularly or intravenously for all the baby because they lack certain clotting factors. So if you don't give it, then they tend to bleed.
Korle Bu Teaching Hospital, another baby is born. Ajara, her mother, Sumaya. Ajara is also giving her first injections. The nurses also ensure Sumaya is taken through all the other essential health check procedures. Dr. Opong is happy with Sumaya's progress and informs her she will be discharged tomorrow. The following day, Sumaya goes home. It has really gone well at the hospital. Ajara is healthy and strong, but will her progress continue at home? Abosokai, Accra. Sumaya arrives home to an emotional welcome. A week later, Dr. Van Otu pays Sumaya a visit.
My favorite Dr. Van Otu.
She is Greater Accra Regional Director of Ghana Health Service. Normally, a community health nurse will make such visits.
I find a good morning. I find a hotel.
In this case, however, Dr. Van Otu agreed to our request to visit Sumaya in order to further highlight some of the issues her office is addressing in newborn care.
Say they be a winning hospital na you catch no. Say Ghana Health Service any share say be mo hospital na adenya so mo wi a na ye nwie ye. Say etoa so ekofie ekohwe say maame no ho te sei akoda no so ho te sei. Na bia se bibi ohonom na maame no onte ase e bia onyem we nya kwan ye mbusa na so okowe ye no kra we ntumi mbusa na otumi ebusa ye.
Dr. Linda Van Otu inquires about the health of the mother and baby.
Ene we didi o ma no fo no papa kama oda.
Dr. Linda Van Otu is particularly keen to examine Ajara's navel. Dr. Linda Van Otu is very happy about how the baby's navel is healing.
Sometimes when you go home, you find that people want their cord to go off as quickly as possible. So they put all sorts of things. Some can put toothpaste, some put sugar cane, some even put cow dung on it to fall off. But in this case, there is no evidence of that, and that is very important.
Dr. Linda Van Otu further examines Ajara. Dr. Van Otu stresses the importance of exclusive breastfeeding.
They say they hear pa ni semboma ni nufo no. So ante nufo dey so no pa onom ba kwa obre we inframa no na we say na one man ba ko no so eno ano no. Sometimes when they get home, especially if the baby cries a bit, then the mother will be told that the breast milk is not enough. Therefore, add some other feeds. Some people put bread into water, squeeze it, and give the water to the baby. Some even give mashed kinky to very young babies like this, or they give them porridge or anything else that they can find. They say, oh, yeah, come on. She has the support of her mother and her aunties, and that is very key because sometimes when they come home, the voices are too many. So although the nurses and the doctors would have informed her as to what she should be doing, the voices in the home will tell her something different. But this time round, they are saying the same thing. Any baby mommy, Madam Wasi. Madam Wasi. Baby, I can see new picture. What does I am very happy, and my hope is that we'll be able to do more of these things. Visit them at home, see how they are doing in their own environment, because that is where we see the true nature of how the baby is going to be cared for or how the mother is doing after her discharge from the hospital.
We have a conversation in the studio with Dr. Linda Van Otu, Regional Director of Health Service, Greater Accra Region. Dr. Van Otu, you're very welcome.
Thank you very much.
Dr. Van Otu, what did you think of the documentary?
I think that was a very brilliant documentary. The reason being that the Ministry of Health and the Ghana Health Service, because Ghana Health Service is the largest agency, is doing a lot and everything possible to ensure that our statistics change. You realize that as a country, though we did a lot and we were able to reduce our maternal and newborn deaths, there's still a lot to be done, and therefore we need to take stock of what we did previously and see how we can do it better. One key thing is that as a service we may do our bit, but the people that we are serving, the people who call our clients, need to be involved. And that is why I believe that going through the documentary, looking at what happened, you can see that we did our bit, but also we brought in the people we serve and the community to ensure that we offer holistic care to the clients who come to us. So that was a very good documentary.
Dr. Vanutu, you've spoken to the documentary, which was a perfect example of how things should go. Now, describe how things tend to go that we lose so many babies, especially in the very first, 7 days after they're born?
Yes, a lot of babies die the first hour they are born, the first day they are born, the first week, or the first month. That's a neonatal death. So if you look at Ghana, you realize that a lot of the child deaths tend to occur within this period. There are several reasons why this happens. During the antenatal, you realize that the mother needs to hear a lot. The mother needs to do a lot. She needs to be able to recognize things that do not go well and report to the hospital early enough. So at the antenatal clinic, the midwives tend to educate these mothers about what they should be doing. But of course, when they go home, they go to their homes. And we have cultural practices that can affect whether they will accept what they were told at the hospital or they will not accept it. So that is one area. One key thing is that we have a lot of women who are anemic even before they become pregnant. Right. During the pregnancy, we give them some medications, we give them some education to help them to build their blood level. Unfortunately, one of the things is that if you eat well, if you take this medicine, if you do this, the baby may be too big. And if you are not careful and you are going to deliver, you'll be delivered by cesarean section. They don't want that. So you find that people do things that to keep these babies as small as possible. So one of the things that kill these babies is prematurity. Another one is low birth weight. Every baby that is born who is less than 2.5 kg is at risk. So when you look at the deaths, you find that prematurity is one of the things, and then low birth weight is another one. The other reason why these babies die is infection. And some of them, because of things that are done, we have them developing infections even at that very tender age, and some of them may die. The other one that also kills them is to do with the time that they are being born. And oxygen is very important. If this baby stays too long in the birth canal before it comes out, the oxygen supply to this baby, especially to the brain, becomes very limited. So this baby is born and we call it the asphyxiated baby. It means that the amount of oxygen that went into this baby's brain was very small. Now there are several reasons why this happens. One of them is that when the woman goes into labor, probably she delays in getting to the hospital. So by the time she gets there, you find that the baby might have stayed in the canal for quite a while. Probably the baby was not able to come because the mother's pelvis was too small.
Right.
Or the baby was not positioned in a way that it could come out easily. A baby coming out should come with the head in a certain position. Now, if it happens that the baby doesn't come in that position, then though this woman might have all the contractions she can have, the baby will not come unless an intervention is given. So this baby can delay in coming.
Wow. Dr. Vanutu, now you've brilliantly described quite a number of reasons that we could lose our babies very early on. But are there specific ways we must care for these babies when they are born to save, to save their lives?
Yes.
In all these instances?
There are. One key thing is that the baby must be born when it must be born. And that is why we have interventions such as cesarean section. We can have other assisted delivery, for example, vacuum. So when we find that a mother has come to deliver, but she's finding it very difficult, and the baby's head is such that they can use this machine to bring the baby out, if this baby is positioned well, then that can be done. In some instances, when they find that the mother's contractions are not strong enough, then they can put some medication into an infusion to give to this woman to aid the contraction.
So what happens when a baby like this is born? You know, the doctors and the nurses will help you to learn how to take care of the baby.
Yeah.
Are there dangers when a mother like this takes a baby, you know, a baby like this home? And what are some of them?
Yes, before we go to the dangers, let me just bring in here that we have what we call the helping babies breathe. We have what we call the golden minute. So when a baby is born and we find that this baby is not breathing as it should, nurses, midwives, doctors are trained to give this baby the support that it needs to breathe. And that 1 minute is very important. Once you do that, you can call it resuscitation, but we are helping this baby to breathe. I talked about oxygen going to the baby. So once that is done and this baby breathes and starts crying, then we are happy. You know, if this baby is born too small, then we have another thing we do, which we call the kangaroo mother care. And this baby is now placed in between the mother's chest on the bare breast, on the bare chest, covered nicely, and this gives the baby the warmth that it needs, brings bonding, and tiny babies have been placed like that and they have survived. A father can do it as well. Now these babies are kept this way, they are kept warm, they feel secure, and the mother now also has that encouragement that I'm doing something positive for my baby. So they are taught how to do this. And they do this, they also feed the baby, because feeding is also very important. If the baby cannot breastfeed, because we put the babies to the breast within 30 minutes after delivery, because otherwise, if their sugar level goes down, again, it will affect the brain. So they are breastfed soon after delivery. If there's any reason why this baby cannot take the breast himself or herself, then it is expressed and given to this baby. So we do that, and then we keep them warm as well. So all these things are done. Now when they are going home, they are taught how to do these things. So during the antenatal, we can use dummies, we can use videos, we can use anything that we have, any teaching aid that we have, to teach them how they can do these things at home. But before they leave and go home, the baby is put to their breast, and the midwives ensure that the babies can breastfeed before they go home. If we don't do this and they go home when the mother is still not sure about how to put the baby to the breast, that is when they would add other feeds. So we do that. We also teach them how to dress the cord. So anything that will bring an infection is also discussed, so that when they go home, we'll be able to ensure that these mothers, and especially the other people who are with them, would know exactly what to do. And the good thing is that now we involve the husbands. So if the husbands know, they will encourage their wives to do same. So we do all that. And we bring in other relevant people. If she has a mother that she wants to bring, or if this woman has her grandmother or mother-in-law, anybody who is going to help her at home is also given that kind of education, so that she understands that this girl is doing this not because she wants to rebel, but because it's been found that these are very good things to do. And then we visit them as well.
Yes.
And they also come for the postnatal clinics as well.
Dr. Vanutu, very interesting points you've raised about, you know, rebellion, etc. Our grandmothers will say, well, this is what I did for your mother, and our mother will say, well, this is what my grandmother. How do we separate the cultural practices, which we have learned from your good self, of course, from the documentary, can sometimes be dangerous in those very first few days? How do we separate and how do we communicate to our families that I want to go according to what Dr. Vanutu has advised?
Yes, that is why we try during the antenatal to showcase the responses to some of the interventions that have been proven to work. So these mothers are told. We even have what we call the pregnancy school, which is held outside the regular antenatal. There you can bring anybody. And then, of course, we have the community health nurses who do follow-up visits in the homes. Now, when they get to the home, they will not just talk to this pregnant woman, but they will talk to the other people who are there. And we have also the pictures, we have statistics, we have things that we can use. I believe we are all aware that we cannot take one day to change somebody's behavior. But once we are able to go through and we have people who can champion what we're saying, probably she has gone through it herself. It could be an elderly lady or this young lady who probably in her first pregnancy, she did something that did not go so well. Now when she does this one and it goes well, she becomes a champion. So we try to get people who have been satisfied with our services to come on board to help us. And we continue with our public education. During the regular clinic time, it may be that you came for malaria, but we can use that to tell you about a whole lot of other things. So that is what we do. And we continue to train our staff, continue to update their knowledge, continue to give them the skills that they would need to ensure that these things are done. One key thing is that we continue to monitor our performance. Because if we want every woman to come to deliver with us, we will know by the numbers that come to deliver with us. So if we don't have 100%, then where are the rest going to? So we try to look at our own performance and see what we are not doing right and do them. And we talk to other people as well. You see, we have to understand why they do the things they do and then use that to address the gaps. If we just tell them to stop doing this, they wouldn't. Because I believe strongly that they would not intentionally do anything to harm the baby.
Of course.
They would be doing those things because they think that they are good for the baby. But if we let them understand the implications of these things, then they will go with us.
Dr. Linda Vanutu, thank you so much for your counsel, your wise words. We appreciate your time.
My pleasure.